Inflammation is the body's immediate response to injury or infection. When tissues are damaged, blood vessels dilate, allowing more blood to flow to the area. This process brings immune cells and proteins to help fight off invaders and start the healing process. You might notice redness, warmth, swelling, and sometimes pain. Inflammation reaches its peak within 6 to 8 hours if the injury is mild. After this, the body begins to repair itself, normalizing blood supply and clearing out immune cells. This process is essential for healing, but if uncontrolled, it can lead to further complications. After the initial inflammatory response, the body enters a reparative phase. During this stage, the blood supply to the affected area returns to normal. White blood cells that migrated to the site either break down or re-enter circulation. At the same time, damaged cells are replaced through cell proliferation. Or if the damage is severe, some cells may disintegrate. This phase is crucial for restoring normal tissue function and preventing chronic inflammation. The balance between cell repair and removal ensures that the tissue heals properly without excessive scarring or dysfunction. Several types of immune cells play vital roles during inflammation. Monocytes and macrophages act as scavengers, cleaning up dead cells and debris. Polymorphonuclear cells, or polymorphs, are the first responders that attack bacteria and other pathogens. Lymphocytes help coordinate the immune response and are involved in the formation of scar tissue. Each cell type has a unique function, working together to clear infection, remove damaged tissue, and lay the groundwork for healing and scar formation. Edema refers to the accumulation of excess fluid in the tissues. This swelling can result from increased capillary permeability, higher pressure in blood vessels, kidney problems, reduced plasma proteins, or inflammation. When fluid leaks out of blood vessels and collects in the surrounding tissue, it causes noticeable puffiness and discomfort. Edema is not a disease itself, but a sign of underlying issues, ranging from local inflammation to systemic conditions like heart or kidney disease. Eyelid edema, or swelling of the eyelids, can have many causes. Inflammatory conditions like blepharitis or conjunctivitis are common culprits. Non-inflammatory factors such as allergic reactions, trauma, or insect bites can also lead to swelling. Systemic diseases, including kidney or heart problems, may cause fluid retention that shows up as eyelid edema. Identifying the cause is essential for proper treatment, as management strategies differ depending on the underlying issue. Angineurotic edema is a sudden, dramatic swelling that often affects one eyelid. It can be triggered by allergies or other systemic factors. The swelling appears abruptly and can be alarming, but it typically responds well to systemic corticosteroid treatment, such as hydrocortisone or prednisolone. Quick medical intervention is important to reduce swelling and prevent complications, especially if the swelling affects vision or breathing. Blepharitis is a chronic inflammation of the eyelid margins. It can be caused by poor eyelid hygiene, bacterial infections, parasitic infestations, or seborrhea. There are two main types: squamous blepharitis, which involves flaky scales, and ulcerative blepharitis, which leads to sores and crusting. Symptoms include redness, irritation, and sometimes a gritty sensation in the eyes. Managing blepharitis requires good eyelid hygiene and, in some cases, medication to control infection and inflammation. Styes, chalazion, and internal hordeolum are all types of eyelid gland inflammations, most often caused by Staphylococcus bacteria. These conditions are characterized by painful swelling, redness, and sometimes pus formation. A stye is usually a tender, red bump near the edge of the eyelid, while a chalazion is a painless lump caused by blocked glands. Internal hordeolum affects glands inside the eyelid. Treatment may include warm compresses, antibiotics, or minor surgical procedures if the swelling does not resolve. Trachoma is a chronic infectious disease of the eye caused by Chlamydia trachomatis. It progresses through several stages, starting with follicular conjunctivitis, where small bumps and redness appear. Over time, repeated infections lead to scarring, eyelid deformities, and, if untreated, blindness. Trachoma is a major cause of preventable blindness worldwide, especially in areas with poor sanitation and crowded living conditions. Trachoma develops in stages. It begins with follicular conjunctivitis, where the inner eyelid shows papillae and follicles. As the disease progresses, scarring and cicatrization occur, leading to eyelid deformities such as trichiasis, where eyelashes turn inward. If left untreated, these changes can cause corneal opacity and eventual blindness. Diagnosis is based on clinical signs and sometimes confirmed with tissue samples under a microscope. Treatment for trachoma includes antibiotics such as sulfacetamide, tetracycline, or erythromycin to clear the infection. Artificial tears may be used to relieve dryness and discomfort. In advanced cases, surgical procedures like trachectomy or conjunctival surgery are needed to correct eyelid deformities and prevent blindness. Prevention is equally important, focusing on good hygiene and reducing overcrowding to limit the spread of infection. Ophthalmia neonatorum is a serious eye infection in newborns, often affecting both eyes. It is usually caused by bacteria such as gonococcus or staphylococcus acquired during birth. Symptoms include redness, swelling, and discharge. Immediate treatment with antibiotic eye drops and ointments is essential to prevent complications. Good hygiene practices during and after delivery are critical for prevention. Ecchymosis, commonly known as a black eye, is bruising around the eye caused by trauma. The injury leads to swelling, discoloration, and sometimes pain. Initial treatment involves applying cold compresses to reduce swelling, followed by warm compresses and gentle massage to help the body absorb the blood and fluid. Most black eyes heal on their own, but persistent pain or vision changes should be evaluated by a doctor. Eyelid malpositions are abnormal positions of the eyelids. Trichiasis is when eyelashes grow inward, irritating the eye. Entropion is the inward turning of the eyelid, while ectropion is the outward turning. These conditions can cause discomfort, tearing, and even damage to the cornea. Treatments include surgical correction, epilation, removal of eyelashes, or electrolysis to destroy problematic hair follicles. Symbelpharon refers to adhesions between the conjunctival surfaces of the eyelid and eyeball, often resulting from burns or severe ulcers. These adhesions can restrict eye movement and cause discomfort. Prevention involves using ointments to keep the surfaces moist and separated during healing. If adhesions form, surgical correction with mucous membrane grafts may be necessary to restore normal eyelid and eye function. Lagophthalmos is the inability to fully close the eyelids, which can be congenital or acquired. This condition exposes the cornea to air, increasing the risk of dryness and injury. Treatment focuses on addressing the underlying cause, using lubricating ointments or performing tarsorrhaphy, a procedure where the eyelids are partially sewn together to protect the eye. Early intervention helps prevent complications like corneal ulcers. Blepharospasm is an involuntary spasm of the eyelid muscles. It can be triggered by ocular irritation or problems with the nerves controlling the eyelids. Symptoms include frequent blinking or forced eyelid closure, which can interfere with daily activities. Treatment involves addressing the underlying cause, such as treating eye irritation or, in some cases, using medications or injections to relax the muscles. Ptosis is the medical term for drooping of the upper eyelid. It can be present at birth due to developmental issues or develop later from muscle weakness or nerve damage. Ptosis can affect vision and appearance, so surgical correction is often recommended to improve both function and cosmetic outcomes. The specific surgical approach depends on the cause and severity of the drooping. Tarsorrhaphy is a surgical procedure where the eyelids are partially or completely sewn together. This technique is used to protect the cornea in cases of exposure keratitis, facial paralysis, or severe ectropion. The closure can be temporary or permanent, depending on the underlying condition. Tarsorrhaphy helps maintain eye moisture and prevents further injury while the underlying problem is addressed. Eyelid tumors are abnormal growths that can be benign or, rarely, malignant. Common benign tumors include pigmented nevi moles and papillomas. These growths are usually removed by complete surgical excision to prevent discomfort or cosmetic concerns. Malignant transformation is rare, but requires prompt and thorough treatment. Regular eye exams help detect any suspicious changes early. Understanding inflammation, edema, and related eyelid conditions is crucial for early recognition and effective management. Many eyelid disorders can be prevented or minimized through good hygiene, prompt treatment of infections, and regular medical checkups. Early intervention not only preserves vision, but also improves quality of life. If you notice any persistent changes in your eyelids or eyes, seek medical advice to ensure proper care and avoid complications.